Since the announcement of COVID-19 in the country, the virus has gone through mutations which have been detected. Now, the Health Ministry has issued a concern about one particular variant that is highly transmissible.
Lineage B117/501Y/V1 first detected in the UK in September of 2020. The B1351/502Y V2 first detected in South Africa in October of 2020, and the B1617.2 first detected in India in November 2020.
Health CS Mutahi Kagwe says with high community transmission, the variants can potentially disrupt efforts to halt further spread.
The ones that we are referring to today are not foreigners, and it is not imported. This is community spread. And this is why we sounded the alarm. But of course, the most important measure is the one that we keep talking about, of wearing masks, keeping your distance. That is the strongest single measure, because we can impose lockdowns and we can do all these things, but by the end of the day, you cannot be able to police each and every person.
According to Kagwe, after genomic sequencing, the Indian and UK variants have been detected in 3 counties of Kisumu, Mombasa and Kilifi.
From Kisumu sub-counties, out of the 39 samples, 28 samples aligned with the Indian variant B1617.1. 6 samples aligned with the UK variant B.1.1.7, and 1 sample aligned with the B1612 first identified in India, while 1 sample with both the UK and the Indian variant is undergoing further sequencing.
These emerging variants have caused a surge in COVID-19 cases across the countries, with the latest positivity rate shooting to 9.4% after 341 more people tested positive to the disease, pushing national tally to 169,697. 144 patients have recovered from the disease, 96 from home-based and isolation care, while 48 were discharged from various health facilities countrywide. Sadly, 11 people have succumbed to the disease, all of them being late deaths reported after conducting facility record audits, pushing the cumulative fatalities to 3,108. To prevent further spread of the disease, the Ministry of Health has announced that a second phase of vaccination will commence tomorrow, with 72,000 vaccines expected in the country from South Sudan.
We are starting with healthcare workers. That is why we started the first time, and this time round, we are also doing exactly the same thing. So kindly, I'm appealing to Kenyans, if you have a first dose, please stay in the queue. Do not try and rush out to get vaccinated.
According to Dr. Willis Ahwale, COVID-19 Vaccine Task Force Chairman, those who received the first jab have already been notified.
The chanjo system is sending the reminder 48 hours to when you are due. So if you remember, on 5th it was only at Kenyatta. So those who are vaccinated there tomorrow, they will start.
Well, despite that one variant, which carries both the Indian and the UK variant, being considered highly transmissible by the Ministry of Health, the ministry insists that we'll have to wait for 1 month for genome sequencing and peer-reviewed to be conducted. Winnie Lubembe for Ebru TV.